Hey everyone, we are here today with Sheena Bice, who is a licensed mental health counselor. She spent time serving in the military. She is a military spouse and then went on and got her graduate degree in mental health and has worked in many different aspects. So she is a true expert and has a perspective from many different lenses. Sheena, thank you for being here. To start with, what are some challenges faced by military personnel and veterans in maintaining their mental well-being?
Stigma. Stigma is really the biggest challenge there is viewing mental health, anxiety, depression as a barrier or a weakness, right? Instead of something that you can overcome and you move through and be successful with. So the stigma is really something that has created significant barriers and challenges for individuals to seek help, want to get help, or even just to embrace themselves and understand themselves a little differently.
So, what are some common mental health issues prevalent in the military, such as we often hear about PTSD?
Yeah, so PTSD, right? Yes, that is going to be something, but I'll always be a broken record. Please do not lead with PTSD. Some of the other things that we are seeing in the military, especially with our returning veterans, is traumatic brain injury. That really does do an overlap. There's a lot of overlap with PTSD, so be cognizant of the two. But also anxiety, depression, grief and loss, substance use, suicidal ideation are all things that are potential within our military.
So, if you are a active duty, you're a veteran, how would we know if you might have PTSD or a TBI?
You're going to feel it, right? So, it's really something that there is going to be changes in anxiety level, hypervigilance, feeling unsafe, startle response, memory, concentration, cognitive changes are all things that I would say talk about it. Let's push into it and look to understand it, because those can be pretty interfering in your day to day. And other pieces like substance use or family relational issues might be present, and it could be a result of some of those underlying challenges.
Sheena, a lot of times when people are struggling, it's those closest to them that see it.
Mhm.
Any advice you have for family, friends of military or veterans that see them having a hard time?
Yeah, so talk to them, know the resources, but be gentle and compassionate about the engagement. Because again, I go back to stigma. What you might find is your service member, your veteran may not be as open or comfortable because it really is a feeling of being out of control at times. So family members are absolutely the best line of defense here. Know the resources in the area, reach out and have that conversation with your loved one.
Why is it important for service members to seek support from the military? I know, like when you're on base, you can have the chaplains. There's the all the veteran service organizations, the nonprofits, community resources. How does somebody know? I guess they got to break down stigma first and be willing to ask for help. But then once they do, how do you figure out how to make it not so confusing of where to go?
Sure. So first off, what I'd say is we need to think differently around our mental health, similar to how we think about our physical health. If you have a broken leg, you're going to go to the doctor, right? So if you're experiencing some of those other challenges, some other mental health issues, think about it as anything else. We need to keep this weapon, our mind, healthy in order to be successful in everything that we do. So once we start thinking differently about it, I think that opens us up. You absolutely have chaplain, go to chaplain services. There's behavioral health officers. There's the SHARP in most instances. There are supports on base that you'd be able to tap into. It's really reading the resources and being willing to push through and potentially asking, if necessary, your sergeant or somebody you trusted within your chain of command to help guide you, because there can be a lot and it can be confusing. But start with understanding this is a tool that we need to keep healthy.
One last question, and I so appreciate your time. What resources can people know about to help them for military personnel and veterans?
So resources, I think, for the military and service member themselves. So we have the veteran service organizations. We do have the VA. We do have organizations, private and for-profit, nonprofit, private practitioners who are geared and trained towards supporting our military members. But there's a plethora of resources out there. American Legion is still good, VFW, all types of connections that if we push into those things, we're going to be able to find our supports where we need it.
How about for their families?
Same thing with the families. I know that the VA isn't always going to be something that's going to have a lot of resources internally, but we have the vet centers that often do things for their families. Again, we have organizations such as my own, Forge Health, that's going to be able to provide peer and clinical interventions for families and friends, but there's a lot of peer supports out there, such as a veteran support network as well. That's a great partner of ours that we're able to move families towards.
Amazing. Thank you so much, Sheena Bice, for spending time with us today.
Thank you for having me.